We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and this.
Hello everyone. Today in Healthy Life we'll be talking about a serious issue. Yes, a serious one. It's about a fatal disease, an outbreak of Lassa fever. I am by name Imin Philemon, and our chief presenter today is here.
I'm by name Nurse Gudia Batlumi. Lassa fever is an acute viral illness caused by Lassa virus, a member of the Arenavirinae family, primarily found in West African regions. It is first discovered in 1969 when two missionary nurses were confirmed with this virus, resulting to their death. That is in Lassa village in Nigeria. Currently, there is an outbreak in Adamawa State.
But thank God for the body of healthcare in Adamawa State here, by the grace of God, under the leadership of our Honorable Commissioner, Nurse Felix Tangomi, and by the backing of His Excellency the Governor of the state and the entire healthcare body. Measures have already been put in place to ensure that this very outbreak spreads no further. And I'm sure and I can assure you that their effort is yielding great fruit.
Yes, I'm proud to be a nurse.
Lassa fever is known to be endemic at parts of Nigeria, Sierra Leone, Guinea, and other neighboring countries. Now we talk about the clinical representation or signs of Lassa fever. Lassa fever signs or symptoms progress from mild to severe, and the incubation period of Lassa fever lasts from 6 to 21 days. The mild signs begins with fever, malaise, there is general body weakness, vomiting, diarrhea, while the severe signs progresses to bleeding through the nose, the mouth, and even the GIT. Lassa fever can also be identified during a facial swelling of the face, the neck, and also organ failure, which can result to the death of a patient. Lassa fever is a serious issue that we all need to put our hands on deck in order to see that Lassa fever is brought to its end. Let's talk about the transmission. The transmission can be one through rodent reservoirs, that is the multi-mammoth rat, is the primary reservoir of the Lassa fever, and coming in contact with the rodent's urine, contaminated food items, surfaces, or feces can expose one to Lassa fever. We also have human to human. This is where an individual can also be infected when coming in contact with an individual that is already infected with Lassa fever. Coming in contact with the person's urine, the feces, the blood can expose one to Lassa fever. Diagnosis of Lassa fever. In diagnosis of Lassa fever, we have the polymerase chain reactions, we have the viral isolation, and we have the ELISA, which stands for enzyme-linked immunosuppressant acid. So, after diagnosing a Lassa fever case, what are you supposed to do? You're supposed to treat. So, we'll talk about the treatment of Lassa fever. In treatment of Lassa fever, we provide supportive care. We encourage fluid intake. In cases of persistent vomiting, we encourage the use of IV fluid, that is intravenous fluid. We also have pain relief. management of complications. There is also an antiviral medication known as ribavirin, which can also be used in the treatment or management of Lassa fever. Let's also talk about the prevention. Lassa fever can be prevented through proper hygiene. Talking about the food hygiene, this is where we need to properly reserve or store our food in a sealed container whereby the rodents will not have access to our food items. We also have, still talking about food hygiene, this is when we need to prepare our meals properly. That is when we cook it the way it's supposed to be cooked, not halfway or half done. Also, proper preservation of leftover food. It's expected or is advised that we properly cover our food that is left for future use, or we can also refrigerate it for safety in order to prevent it coming in contact with such the rodents, excretors or urine, or having them feasting upon our leftover meal, which we might not know when we come to use it subsequently. Lassa fever can also be prevented through personal hygiene, that is frequent hand washing. When you touch a surface, you still go back to wash your hands, especially before ingesting any material or food through our mouth and also the nose or touching it. The hands is one of the easiest way to transmit diseases, not leaving Lassa fever behind. It is also advised that you also maintain environmental hygiene. That is where we clean our environment, not creating a habitation for these rodents because they love where there is dirt, especially when we keep containers that are not useful, or when we now have a bushy environment or a dirty environment, especially when we also have our waste bins around us or within the home. So our waste disposing areas should be located away from our residents in order to prevent the spread of Lassa fever. Lassa fever can also be prevented through the use of personal protective equipment, which is the use of hand gloves, sanitizer, masks, boots, goggles. This is especially for the healthcare providers, and especially when you're suspecting a case, you shouldn't be careless. This is a period where every nurse, every doctor, every healthcare provider must be sensitive and watch each of your patients coming in carefully and observe carefully. Proper isolation of suspected cases and contact tracing of confirmed cases in order to prevent the further spread of Lassa fever. Healthcare practitioners or providers are expected to pay close attention to every patient that comes in, especially with these signs of Lassa fever. Public health response. What are the response? One, we have surveillance. We should establish surveillance system to monitor for Lassa fever outbreak or any suspected case of Lassa fever, including rapid detection and timely reporting of suspected case of Lassa fever. We also have outbreak response. This is where we implement the coordination and response during outbreak of Lassa fever, including isolation, proper contact tracing, and provision of medical care. We will also talk about community engagement, which is very, very paramount. The community needs to be engaged in the prevention of the spread of Lassa fever through health education of the community members and creating awareness especially in those signs they see, and they'll be able to identify that yes, this is a suspected case of Lassa fever, or this is a Lassa fever case. So it is very important that the community need to be involved in the prevention of the spread and control of Lassa fever. In these early measures of recognition of symptoms, it will be very important. In conclusion, Lassa fever poses a significant public health threat in West Africa and even in Nigeria. So it's requiring a comprehensive measures. That is where all of us need to come in depth in order to prevent the spread of this virus. Early detection and early diagnosis of Lassa fever is very, very paramount. Let's not be careless. Let's not be reluctant, because health is wealth. So I advise each and every one of us out there, we should pay attention to the issue before us, which is Lassa fever. Thank you.
Nurses are caring, an epitome of humility in service. We are specially ordained for this vocation. Yes, I'm proud to be a nurse.